keratosis, actinomycosis, bronchopulmonary mycosis, meningoencephalitis. These words may be hard to pronounce, but they are easy to learn their meanings. Welcome to Medical Terminology. My name is Quilisha Patterson and I will teach you how to decipher the meanings of medical terms without using a dictionary or thesaurus. In this video, you will be able to 1. Explain why understanding and learning medical terminology is vital to your career. 2. Explain the 3 basic components to medical terminology. And 3. Break down the meaning of medical diagnoses, conditions, symptoms, and procedures by using the 3 basic components to medical terminology. Why is it important to learn medical terminology? In order to be successful as a medical coder or in any medical career, it is very important to learn medical terminology. Learning medical terminology helps you understand and interpret the doctor's and nurse's medical notes in the patient's medical records, which will in turn help you to translate them into accurate ICD-10, CPT, CDT, and HCPCS codes. These codes ensures that the providers and healthcare organization is paid accurately and timely for patient healthcare services. Medical terms generally have 3 parts: root words, prefixes, and suffixes. When you put them all together, these 3 components create a more specific medical term. Some medical terms may have all 3 parts, whereas others might have only 1 or 2 parts. Basically, no need to pull out the dictionary or thesaurus anymore. If you study these root words, prefixes, and suffixes, then you will be able to find the meaning of the medical term. Now let's look at the meaning of these 3 components. Root words are the part of the word that can stand alone as the main part of the medical term. It holds the fundamental or root meaning of the medical term. Sometimes, medical terms can have more than 1 root. This slide provides a brief list of root words and their meanings. For example, the root word for derm means skin, and the root word for gastro is stomach. Prefixes are typically attached to the beginning of words to change their meanings. They usually defines and specifies the location. Prefixes are typically attached to the beginning of words to change their meanings. They usually defines and specifies the location, time, or number. Just like prefixes, suffixes are used to change their meanings, but are usually at the end of a word. They typically indicates the procedure, condition, disorder, or disease. This slide provides a brief listings of suffixes and their meanings. For example, the suffix plasty means surgery or repair, and the suffix ectomy means excision or surgical removal. Now let's tie these all together to break down a meaning of a medical term. For example, do you know what rhinorrhea means? Rhino is a root word for nose, and the suffix for rhea means flow or discharge. Combine the meanings of the root word and the suffix, and you get a runny nose. Easy, right? Let's try another one. Now let's try a more difficult one. Do you know what cardiomyopathy means? Cardio is a prefix for heart, and the root word for myo means muscle, and finally, the suffix for pathy means disease. Combine all 3 parts and you get a diagnosis of the disease of heart muscle. In this video, first, we explained why understanding and learning medical terminology is vital to your career. Second, we explain the 3 basic components to medical terminology. And finally, we use the 3 basic components to break down the meaning of medical diagnoses, conditions, symptoms, and procedures. Thank you for watching my video.